Hey guys, I'm going to answer a few questions about clinical rotation now that we're over a month into this and it's already going to be July. I can't believe that. Time really is flying. Seen so many cool things though, learned so many things. The hands-on experience is absolutely amazing. I don't know, I feel like I learn best when it's all hands-on and you can show me how to do it one time and then I feel like I can just remember it or, slowly work my way through it. But the first question is, now that you are over a month in your clinical rotation, where have you grown and what do you see as your strengths? I feel like I've definitely grown in being more confident in myself. That was originally what my goal was set to, was just be confident and know that I can do what I'm learning and actually just practice it. And I don't know, I feel like I've really grown in that and I'm not afraid to just kind of jump in and get to work. And yeah, my preceptors I feel more comfortable around and they're really helpful, but it was really hard to get used to all of them at first and different personalities and different ways of working, different shortcuts they would take, all that type of stuff. But yeah, I guess more confident, and it's definitely helped me. I've learned lots more just being confident in asking questions, because I mean, everyone knows that sometimes you have questions that you want to ask, then you're like, I don't know if I should ask a surgeon that. I feel like I'm going to sound silly if I ask that, but really, if you just ask the question, it's fine. Someone else may be thinking that. If not, then you know the answer. What do I see as my strengths? I feel like one of my biggest strengths that I've noticed in myself is when I set up my back table, I feel like I'm touching the things one time and putting it in the location of where it needs to go, and I process that through my mind as I'm setting up, and it's helped me just okay, here's the sponges, I'm gonna not open them yet because I count that with the circulator, but I'm gonna take the sponges and I'm gonna put them over here and leave them there and do not touch them again. But yeah, I don't know, because at first I feel like it was just clustered and just stuff everywhere and I got so overwhelmed, but now I keep reminding myself that I need to just touch it one time and put it in the place that it needs to go in. And my preceptors have all been telling me that too, and I'm like, dang, this must work for everyone. And I guess it really does work, because I really am seeing a difference and I've definitely strengthened that in myself, so it's good. What do you see as your weak points? My weak points, I guess, is it's hard to stay focused completely when you have about 10 different things being told to you to do, and still trying to process where you are in the surgery and what anatomy you're in. If you're super deep, you need the longer instruments or whatever it may be. It's very overwhelming to try to do all those different things at once. And I came into this program thinking that I could multitask pretty good, and that is definitely a challenge for me, just trying to okay, this is where we are in the surgery, this is what we're going to need next, and then, they say, we need this retractor, and I'm like, oh my gosh, okay, hang on, and I have to just stop thinking about where we are in the surgery and just give them the retractor or whatever and continue back on to thinking. So that's definitely pretty weak for me, I guess, but practice makes perfect, I guess. Another one of my weaknesses is definitely knowing what the surgeon says and asks for. There's so much stuff going on, and I'm so focused on getting my Mayo stand ready and get my back table ready and keeping everything sterile, keeping myself sterile, and having every single thing set like that, and then a surgeon mumbles something off, and I literally am like, okay, I'm sorry, what did you just say? What was that? And sometimes they get really frustrated, but I don't know what they're saying. They just mumble it, and they're so quiet, and I don't know. Maybe if I guess if I stand closer, maybe, or really, really focus on exactly what they're saying, and maybe, I don't know, watch their facial expressions, watch their mouth, see what they're actually saying. Because it is kind of hard when a preceptor's great to have, absolutely great, teaching us how to do everything and walking us through and being there for us if we absolutely need them. But sometimes, you're trying to talk to them, you're trying to learn, and then a surgeon will mumble something, and the preceptor kind of looks at you, and they're like, did you hear that? They need this. And I'm like, oh, gosh, I didn't hear that, but okay, I'll get it for him. And it's just kind of, I don't know, all over the place. So much stuff going on. But I think to work on that, I will stand closer and just really, really, really try to focus on exactly what they're saying, because that is definitely a weakness of mine, and I don't know. It's hard. Everyone keeps telling me, Kelsey, you don't have your OR ears yet, and I sure as heck do not, because some of the times I just have, I'm completely clueless. I'm like, I'm sorry, but I have no idea what you just asked for. And I mean, some of them laugh, some of them don't, because I know it is serious, and I really do need to work on that, but it does take practice, and I don't know. I'm a pretty loud person, so I guess I don't know. I'm looking for a little bit more aggressive of asking for something, I guess. I don't know. I just really do need to work on it, get closer, listen to them, and yeah. I totally get that if someone keeps asking you what you said can get very annoying and very frustrating, but I feel like sometimes it's just what you have to do. There's so many noises going on, there's so many different things going on, all the different equipment plugged in, the noises it makes, the instruments, whatever it may be, talking. It's just, there's lots of stuff going on, and I mean, it is okay to ask again. I've seen my preceptors do it, but I understand that it really is something that I need to work on, and I will work on it because I want to be better, and I kind of want to anticipate on what the surgeon needs more so than just listening to them and like having them wait a couple seconds until I get what they need. So yeah. Have you reached the goal you set during your last vlog? I kind of already touched on that. Well, I guess in my last one I said more so like not standing around and doing more things and not being afraid to jump in, which I did touch on that a little bit, that I have, and I've become more confident in myself, and it's definitely benefiting me because I feel like I'm learning so much more, just being confident and wanting to learn. Not that I didn't want to learn, but sometimes it was just overwhelming, and I can be pretty shy, I guess, but yeah, it's just a lot of information all at once, and learning from a textbook and going to real life, and yeah, it's absolutely crazy. But for the most part, I have reached my goal. I'm not as uncomfortable, and I feel more confident in myself, and I feel like that's the number one thing, is feeling comfortable with yourself and knowing that you can do it. Yeah. If you met your goal, how do you feel about your progress? I feel pretty good. I feel like after making the vlog, like setting that goal, like I literally went to clinic and I was like, all right, like this is what I'm going to do. I'm going to become better by being more confident and not standing around, jumping into doing whatever I can, and yeah, getting as much practice as I can, which I don't know, that really helped me to just remember my first vlog and keep telling myself, like, this is what I said my goal is, and I'm going to stick to my goal. And I've always been a person like that. If I want something, I'm going to get it because I'm going to push myself, and I set goals all the time, and yeah, I always like to follow through because it's just how I am. But obviously I can still work on it. I still am going to be uncomfortable in some things and maybe not know exactly what's going on and get overwhelmed and get down on myself, but confident is key, and I'm really going to concentrate on being confident at all times and telling myself it's okay if I make a mistake, because then I'm going to know next time not to do what I just did. And I mean, that can boost your confidence too, definitely. Like, okay, I know I did this wrong, but next time I'm totally going to get this right. And yeah. Did your goal meet your expectation? It did meet my expectation, definitely, and I don't know. I feel like these vlogs are nice too, because we can just kind of talk about things and get things off our shoulders, but yeah, I guess it did meet my expectations, and yeah. The next question is, if you didn't meet your goal, what went wrong? For the most part, I feel like I did meet my goal pretty well, but to a point, I feel like I'm always kind of gonna feel a little bit uncomfortable just because I'm not an employee at the hospital. Like, I'm a student, I'm learning, I'm kind of interfering with what they do on a daily basis when they work together and maybe don't have a student or whatever it may be. I mean, it is kind of hard to just kind of jump into something that they've been used to doing for weeks, months, years, however long that they've been working together. And yeah, but for the most part, I think it did go well, and I did meet my goal for my standards. Next question, did you decide to go in a different direction? I guess I don't think I went in a different direction whatsoever, because I wanted to work on one thing, and I guess I went in the direction of that. I don't know. Now set your next goal. What mountain are you going to climb next? I feel like my next goal is definitely going to be working on anticipating on what the surgeon wants, rather than waiting for him to just tell me what he wants, he or she. I feel like sometimes I get caught up in refreshing my mind with what the names of the instruments are called, and kind of practicing, but I need to take it more serious and anticipate on, like, if I'm going to hand off suture, I'm going to need scissors. Don't wait for the surgeon to ask for the scissors. Have the scissors in my hands, or put them up on the Mayo stand where they can reach them, or put them up on the red mat that lays on the patient, or wherever it may be that they know that the scissors are there. A couple different times I've handed off suture like that, and I mean, I know that you're going to obviously have to cut it, but sometimes you just don't think that having them in your hand is, like, I don't know, the surgeon appreciates that and knows that you're paying attention and wanting to learn, wanting to do good. So that's definitely going to be one thing that I work on. And also, like, if you're going to clamp it, then you're going to cut it, then what are you going to need? You're going to need some suture or another clamp or anything like that. I mean, even to the point where they ask for one thing, I feel like instead of getting one hemostat, you're going to get 2, 3, 4 hemostats and put them up on the Mayo stand, and just be ready for anything and know what is going on and what the surgeon's going to need. So yeah, I guess that's going to be my next goal. Also, maybe just doing cases completely on my own. Like, sometimes the preceptors, I need them to help me, like, which step do I take next, or how do I do that, or I don't understand what the surgeon's asking me. Like, I like the challenge, and I like to kind of not know what to do and, like, figure it out myself, critical thinking and all that type of stuff. But I do want to, like, run through a whole entire case by myself with my preceptor obviously scrubbed in right next to me. But, like, I want to do every single thing my way, even if it is a couple delays in the surgery. I mean, the surgeon understands that I am a student and I am learning to a point, but I really do want to focus on pushing myself to be better and actually do a whole entire surgery myself. And yeah, I mean, I think I can do it. It's just going to be the little things that I really need to focus on, like I guess just getting my back table set up quickly. And I guess a couple of the preceptors have taught me to do, like, set up normally, get everything out, whatever, but then get all my countables, like, in one area or the area that it's going to be in, and know in my head where they are, and count with the nurse so he or she can get out of the room to go get the patient. And then you still have, like, at least a couple minutes, at least 2 minutes to finish setting up, whether it's rolling a towel to put underneath your stringer of instruments or taking the stringer out. Yeah, I guess just whatever it may be to continue getting ready, so that you're 100% ready when the patient's in the room. But yeah, that kind of has made things go quickly and smoothly when I've been practicing and doing surgeries. But I don't know if it's the 100% right thing to do, but I feel like I'm going to practice doing that and see where it takes me.